Welcome to this educational video about parasitic conjunctivitis. This often overlooked eye condition can cause significant discomfort and, in rare cases, vision impairment. We'll explore everything from what causes it to how it's treated, providing you with a comprehensive understanding of this fascinating and sometimes frightening disease. Parasitic conjunctivitis, as the name suggests, is caused by parasitic infections affecting the conjunctiva, the clear membrane that covers the white part of the eye and the inner surface of the eyelids. Several parasites can be responsible, but the most common culprits include Thalasia worms, also known as eyeworms, and less frequently, certain types of mites or larvae that find their way into the eye. These parasites are often transmitted by flies that feed on the eye secretions of infected animals, and in some cases, humans. Once a parasite like Thalasia enters the conjunctival sac, it can reside and reproduce there. The physical presence of the parasite, along with the toxins and waste products it releases, triggers an inflammatory response. This inflammation damages the conjunctival tissues, leading to the classic symptoms of conjunctivitis. The parasite's movements within the eye can also cause further irritation and damage, disrupting the normal function of the conjunctiva and potentially affecting the cornea in severe cases. Parasitic conjunctivitis isn't as widespread as viral or bacterial conjunctivitis, but it's certainly not rare. Its prevalence varies geographically, with higher rates observed in regions where the vector flies that transmit the parasites are abundant. Rural areas, agricultural settings, and regions with close animal-human interaction tend to be hotspots for this type of infection. Specific species of Thalasia, for example, are more common in certain parts of Europe, Asia, and North America. The symptoms of parasitic conjunctivitis can be quite noticeable. Patients often experience red eyes, excessive tearing, itching, and a gritty feeling, as if something is constantly in their eye. They might also have blurred vision or sensitivity to light. In cases caused by larger parasites like Thalasia, it's even possible to see the worms moving on the surface of the eye. The discomfort can range from mild irritation to severe pain, significantly impacting daily activities. Diagnosing parasitic conjunctivitis typically involves a thorough eye examination by an ophthalmologist or optometrist. A slit lamp microscope is often used to visualize the conjunctiva and cornea in detail, allowing the doctor to identify the presence of parasites directly. In some cases, samples of eye secretions may be collected and examined under a microscope to confirm the diagnosis and identify the specific parasite responsible. A detailed patient history, including travel history and potential exposure to animals or flies, is also crucial for accurate diagnosis. While parasitic conjunctivitis doesn't generally have distinct classifications or types in the same way as bacterial or viral conjunctivitis, it can be categorized based on the specific parasite causing the infection. For example, you can distinguish between Thalasia conjunctivitis and conjunctivitis caused by mites or other less common parasites. Understanding the specific parasite is important, as it can influence the treatment approach and management strategies. The primary treatment for parasitic conjunctivitis involves the physical removal of the parasites from the eye. This is typically done by an eye care professional using forceps or other specialized instruments under magnification. In addition to parasite removal, topical antibiotics or anti-inflammatory eye drops may be prescribed to treat secondary bacterial infections and reduce inflammation. In severe cases, oral medications might be necessary to eliminate any remaining parasites or address systemic effects. Preventing parasitic conjunctivitis largely depends on reducing exposure to the vector flies that transmit the parasites. This includes practicing good hygiene, such as washing hands frequently and avoiding touching the eyes, using insect repellent, wearing protective eyewear, and controlling fly populations around homes and farms can also help minimize the risk of infection. Regular deworming of domestic animals in endemic areas is also an important preventive measure. The prognosis for parasitic conjunctivitis is generally good with prompt and appropriate treatment. Once the parasites are removed and any secondary infections are addressed, most patients experience a full recovery without lasting complications. However, untreated infections can lead to chronic inflammation, corneal damage, and in rare cases vision impairment. Recent research is focusing on developing more effective and less invasive methods for parasite removal, as well as exploring novel drug therapies that can target the parasites directly. Furthermore, ongoing epidemiological studies are helping to better understand the distribution and risk factors associated with different types of parasitic eye infections.